Hello again, everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System, bringing you another COVID-19 community briefing. Today's date is October 13, 2021. It's been a while since we've talked, so I'm going to give you a little bit of information, and the data is not necessarily consistent with what I've given before, but I'll go through some of the stuff, and at least it'll be hopefully vaguely familiar to you. We're going to start out with the Iowa 14-day positive average. Not a lot of change in that over the last month, really. The data as of 10/12, which was yesterday, which is the most accurate data that we have, is 9.2%. I do have 3 weeks of information prior to that. So a week ago, that number was at 9.5. 2 weeks ago, 9.5, 3 weeks ago, 9.4. So very little change over the last 4-week period. The 7-day average for Iowa is at 8.7. So again, not much difference there between the 7 and 14-day. Sioux County, again, not a lot of change, but a little bit different. The 14-day average is 6.4%. 9/27 was the last date that I had. That was 4.8. So it's gone up a little bit from September 27, but that had gone down from September 20 at 5.3. So the last 3 data points I have are 5.3 on September 20, 4.8 a week later, and today 6.4. The 7-day average for Iowa is at 5.0. So again, roughly, Sioux County is a little bit over half of what the state rate was from a positivity standpoint. I also talked about the breakdown of positivity percentages or positive tests by age class. And particularly important, I thought at the time, was the under age 29 group, particularly with schools opening up month of September, colleges back in session, that type of thing. And it's pretty interesting, actually, that the rate is going down in that population group. Today, the 0 to 29 rate in Iowa is 32%, 6% 0 to 17, and 26% 18 to 29. So a total of 32. Comparing that to the last time I looked at this was September 27, that rate was 38%. So it's actually gone from 38% to 32%. And the data prior to September 27 indicated 40%. So again, 40 to 38, and now at 32. So that's I guess good news, but it's pretty reflective of the fact that the virus is not running rampant in schools or in colleges at this point. I'm going to share my screen at this point. Again, this is something we started to do recently as well. This is the new Iowa COVID-19 dashboard that is updated, I believe, 3 times a week. And so you could go to the coronavirus.iowa.gov website, and this is the first thing that comes up. You can look at this as many times a week as you want, but it's only updated 3 times a week. I thought what I would do is kind of look at some of these numbers and give you some historical perspective of them. 598 right in the middle, which is the number of COVID patients in hospitals, in number of Iowans in hospitals, is 598. That number a week ago was 626. Week before that, 624, and the week before that, 638. So the 598 has gone down over a period of the last 4 weeks, but not a lot. Generally speaking, I would classify these numbers as steady. Not much change, measurable change over the course of the last month or so. When you look at the number of patients in the ICU, the number of COVID-19 patients in the ICU, that number is 150. And again, not much change over the last 4 weeks. A week ago, that number was 141. Week before that, 157. And the week before that, 161. So still people getting sick, still people in the ICU, and it's still an issue for us. Looking down at the number of Iowans fully vaccinated, 18 years and older, that number is 66.8%. 3 weeks ago, that number was 65.4%. So we've added 1.4 percentage points to that. In terms of the doses given, 3.5 million. That is about 143,000 additional immunizations occurring in Iowa over the last 3 weeks. Another thing that we've been looking at and paying close attention to is those not fully vaccinated. So those who have not received the full doses of Moderna, Pfizer, or the Johnson & Johnson represent 84% of the COVID-19 patients in the ICU. So it's not 100%, so still vaccinated people are getting sick and still being in the ICU, but 84% of those COVID patients are non-vaccinated folks. That number has stayed very consistent over the last 4 weeks again. A week ago was at 85.8, week before that 84.7, week before that 83.9. So very consistently in that 85-ish range. The last number that actually second to last number we looked at is the long-term care outbreak status listed under outbreak, and that's 3 or more residents in a nursing home. That number has been up for quite a while now. It's at 29 currently, so 29 nursing homes in the state of Iowa are listed technically in outbreak status. And again, that means 3 or more positive residents. A week ago, that number was 31. The week prior to that, it was 25. And the week prior to that is 29. So really staying very consistent. The last number that I want to talk about on this is the number of deaths. Iowa now has 6,748 deaths. That number has risen several hundred over the last 4 weeks. It's still important to note, however, that the demographic of those deaths has not changed. There's still 0 deaths from COVID-19 in Iowans aged 0 to 29, 0. And that's a very good thing. I think the 30 to 39 age group had 1%, but the 60 plus group is 91% of those deaths. So this has remained consistent throughout. It's typically the older folks who get in more difficulty with this, and particularly those older folks with comorbid conditions, other issues going on, in other words. So again, the important part of this, 0 to 29 age group, 0 deaths. So nothing, again, with that demographic has changed. I'm going to go back now and just give you a couple things that are going on as really an update in the health system. First of all, the vaccine mandate. We have not changed our position at all on that, really ever. And that is that we are pro-vaccine, but anti-mandate. We are still awaiting some guidance from President Biden's September 9th announcement that healthcare workers were going to be subject to a vaccine mandate. We have had no guidance since September 9 on that. There are no dates, deadlines, anything with that. And so we are just steady as she goes relative to encouraging employees to get vaccines, but we are not in the mandate mode at all at this point. Relative to policies and Orange City Area Health System, we are not changing anything currently regarding our masking policy, our screening policy, or access to our cafeteria. Our cafeteria will remain closed to the public and for the time being. But we are all very, very tired of wearing masks. This is not something by any means that we enjoy. We feel we are held to a higher standard here in the health center to mask. We are doing so. We're requiring others to do so as well when they're here. And we do not anticipate changing that in the near future, defining near. Hopefully in a couple of weeks, we'll be in a position that the numbers are starting to recede. But right now, we have no prediction with that. Boosters are another topic that's out there. I'm not going to talk a lot about it, but as of where we stand today, it's still Pfizer only, and it's pretty much limited to immunocompromised folks and long-term care residents. If you think you're immunocompromised or you think you might be eligible for a booster, again, you would have to receive the Pfizer initial vaccine, and you will need to have a doctor's documentation regarding some immunocompromised position that you have. This gets a little complicated. If you have questions, please call 737-2000 and our triage nurses can help you with that. So again, pretty much limited to immunocompromised and long-term care residents. I think it is important for you to know, though, that all of our long-term care residents have received the booster dose. They received the Pfizer dose, and so therefore they received the booster Pfizer as well. So our most vulnerable people have been that extra level of precaution and protection with the booster. Regarding children's vaccinations, still awaiting specific guidelines, particularly for the 5 to 12 year olds. So no news on that, no action on that. Maybe anticipating something later this month yet, but no guidance yet on the 5 to 12 age group. Throughout these briefings, we've talked about keeping your engine tuned and how important that is. We've talked about fitness, we've talked about blood sugars, we've talked about blood pressures, diet, exercise, all those kinds of things. But we haven't really talked very specifically about them. And so one common thread that's there right now is to stay active. I think that's really important. We advise that even if diagnosed with COVID, staying active is important. Of course, under your doctor's guidance and direction, but generally speaking, sitting home on the couch is one of the worst things that you can do to keep those lungs expanding and keep oxygen coming in. So stay active within reason, but stay active. One of the approaches that it's a general, while we're speaking of wellness, one of the things that we would throw out there right now is if anybody's interested in some specific wellness programs, either individually or even in a group setting, we can help you with that. Amanda at Aspire Therapy can certainly give you some guidance, talk you through some programs, help you out, give you some guidance. That number for Amanda at Aspire Therapy is 707-6060. So please take advantage of that. Now back to the keeping your engine tuned and some additional specifics. Next week, Friday, we will be doing a special briefing with guests Olivia Chapman and Dee Meerdink. Olivia is one of our folks very tuned into the diabetes issue, blood sugars, our former diabetic education coordinator, now nurse practitioner with us, and Dee Meerdink, our current diabetic education coordinator, will be joining me next week, Friday, and talk through all you want to know about blood sugars, type 1 diabetes, type 2 diabetes, what's an A1C level, why is that important, what's been going on with COVID, with diabetes during this COVID time, and why do we care? Why is that important? So look for that next week, Friday. Hopefully that'll be published late Friday morning, early Friday afternoon. And I know you will benefit from the knowledge that Dee and Olivia can provide. So that's it for today. I'm going to close again with a saying that came across recently, is a little bit of risk management. And the saying goes like this, that the risk is low enough right now to live your life, but it's high enough to be careful. So go out there, live your life, and we appreciate you joining us today. And again, look forward to next week, Friday, with Olivia and Dee. Thanks again.